Thank you for being here to talk to me about starting babies on solid food. This is a big topic for a lot of people, and you're here because you are a registered dietitian, so you know a whole lot about nutrition, done a lot of education regarding all kinds of nutrition, but then you've also specialized in nutrition for babies, and so that's why you're here. You also teach our starting solids class. It's a baby led weaning class, which you do virtually.
Mhm.
Breastfeeding success. And so the topic today is just babies' first foods. What should they eat? And then, you know, a lot of other stuff that goes into starting the babies on solids, going from milk to other stuff.
Mhm.
So to start with, when do you think people should start introducing other things?
Yeah, so most babies are ready around 6 months of age, um, but we do wanna make sure that they're developmentally ready too, so that they are sitting up on their own, not having to prop them up or use a lot of, support, that they can sit up very well on their own. That's gonna help prevent choking, which is a common concern. We're also looking that they're interested when parents are eating. They're wanting to grab our food and bring it to their mouth. They're bringing toys to the mouth. They are grabbing things and with good precision too. They're not bringing it up into here. They're actually bringing it up and have good precision to their mouth.
Okay.
Um, mhm.
So if they're still hitting themselves in the forehead, right, they shouldn't be eating solid foods yet?
Right. Right. Yeah. Yeah.
Okay, good. Um, and then, I mean, is there something else about making sure they can sit up? I mean, I know you've mentioned to me before that having them at the table with you is good. I mean, I
Hmm.
guess that's one way to tell that they're interested is they're there watching you. Um,
Right.
is there any other reason for doing that helps?
Yeah, before 6 months, their GI system just isn't mature enough to handle solid food. Um, so I definitely wouldn't recommend starting before 6 months, um, but that being able to maintain that sitting position on their own, is, a good key indicator, um, like I said, just to prevent choking and making sure that they're safe while they're introducing solid food.
Yeah. And I imagine that's just the best way to know that they're actually interested too. I mean, you said, you know, you can sometimes know they're ready because they're acting interested in your food, but if they're never sitting with you at the table, when you're eating, right? Yes. Um,
Right.
what
Mhm.
about the idea of putting the baby in a high chair over there in the corner, eating separately, and
No.
then having your meal later at the table?
Right. No, and that's, in the class, we talk a lot about the baby-led weaning approach, which that and, the goal of that is to include baby in the family meal and with what you're eating, and, introducing kind of that intuitive eating at an early age. Um, but yeah, the goal is that hopefully they have something on their high chair plate or at the table that you also have on your plate, whether it's a strawberry or a piece of banana or a sweet potato fry or something like that, that you have the same thing that they're eating. And it allows you as a parent to be able to eat freely as well, because they can entertain themselves for a long time there at the table with the food. They're playing with it, they're exploring it. Um so it's kind of a win-win. Baby's happy and you're happy while you're eating.
I do remember a lot of playing with food and having to be patient with that, and sometimes it gets messy, but they do have so much fun with it. It
They
is a
do,
really
yes. Uh-huh.
fun activity, so
Yes. Yes,
a
but
lot
it
more
will be messy.
a lot more fun than that spoon feeding, right, which can also be very messy when
Yeah.
when it comes back out.
Or they
Um,
they swat the spoon away and it goes
yeah,
flying, yes.
yeah. That was definitely a more frustrating experience for me, when I tried it. I didn't try it for very
Uh-huh.
long. My laziness kinda got the better of me. Okay, so now you kind of know your baby's ready, and what are some of the concerns that parents have about starting solids and when making their choices?
Yeah, so one of the most common concerns is choking, which we discuss in great detail in the class. And we want to definitely make sure that we know that choking and gagging are not the same. The babies are going to gag. They're trying new things. They're putting new things and new textures in their mouth, and they're going to have a gagging reflex sometimes. And babies have a very sensitive gag reflex, and that's not the same as choking. Um, as far as choking goes, we want to take every measure to prevent that. So we talk a lot about size and texture and readiness. If they're not ready and they can't maintain that sitting position, then we need to wait so that we can do it safely. Um, and then I do recommend that every parent take the infant CPR and choking class so that they are ready. Hopefully, they don't ever have to use that, but at least they would know how, just in case.
And then you can feel more confident about trying new things,
Mhm.
right?
That's right.
Um, and what else? Like, what other kinds of things are parents worried about when they're starting solids?
Yeah, a lot of parents, and including myself, with small uh, babies, was high allergen foods. We are can get very concerned about that, especially if there's a family history of food allergies. So we talk about how to start incorporating those and exposing your baby to those high allergen foods in a safe way, um, and one at a time. Um, but it can be done very successfully and early on, and you can check those foods off, and then not have to worry about it anymore. But if there is a strong family history, then there is a different path that we need to take to before we expose babies to those foods.
Okay. And it's not a super long list of
No.
foods that are more
Yeah.
likely to cause allergies, right?
Right.
Okay. What else? What other kinds of things are people worrying about?
Some parents are worried about how it's going to go at home versus at daycare. So we talk about how to get a plan for that, or if grandparents or babysitters are coming over. Um, we definitely want it to be a good experience and not stressful for the baby or for the parents or caregivers at any time, because it can be really fun watching baby try all the new foods and everything.
Definitely. I hadn't really thought of that. I guess it's not the most common way to start feeding a baby solid foods,
Right.
the baby weaning method. So some people might be more resistant to it.
Exactly.
Okay, what else? Are parents needing to worry about making sure their babies have perfectly balanced meals every day?
You know, Especially when they first start baby-led weaning or introducing solids, baby's still getting all the nutrition from breast milk or formula. We don't expect those feeding sessions or the amount to decrease for quite some time. Um, I always say food before one is just for fun. It's more of an experience. They get to touch it and feel it and try new things, but they're still getting all their nutrition from, like I said, from their milk feedings for quite some time after introducing solids. After they do start taking a little bit more and cutting back on their feeds, we do of course want it to be very balanced and healthy and minimal processing. Babies can't handle a lot of salt with their immature kidneys. um, and then we're also concerned about iron, so we want to make sure that babies have 2 servings of high iron food a day. So we talk a lot about how to do that and which foods are higher in iron, and not only iron, but the iron that's easily absorbed in the body.
Like rice cereal?
No, no, rice cereal actually isn't very well absorbed, so it's not a great source of iron for the baby. They're a lot better off getting it from whole food sources.
Okay. I just say that jokingly because rice cereal was the thing that just grossed me out more than anything when I first
Yes.
with my baby. I felt like it was was feeding my baby mucus. It was
Uh-huh.
not my favorite thing for sure.
Not
So
very
good to
appetizing.
know. Um, Not at all. Okay, so now kind of just can you share some ideas for first foods, like specific foods that might be good to start with?
Yeah, yeah. So, fresh fruit is good to start with. Um, Anything but raw apple. We want it to pass what I call the squish test. So when you push into it, it has a little bit of squish. It's not going to be able to break apart real easily or crispy. So that means if we do vegetables, they need to be roasted or steamed or cooked. Not to the point of mushiness, but to the point where they would pass that squish test and not break off in the baby's mouth. And then more than anything, we talk about the importance of size. So babies have chubby little hands, and it's kind of a one grasp motion. So we want them to be. I have pretty small hands, but I like do the 2-finger test, a rectangular shape that they can easily pick that up and bring it to the mouth. And then some foods have what I call like an integrated handle already, like a broccoli spear or a cauliflower spear or a chicken drumstick, things like that are good to start with. So it's kind of up to you, and hopefully they're, like I said before, that they're eating something that you're eating at that meal as well.
Okay. So it needs to be about the right size and shape. The two-fingered test.
Hmm.
So it's about like this big, right? Okay, I
Right.
can't keep my fingers
Rectangular
together.
in shape if possible.
Okay, or a spear, something they
A
can
spear.
grab easily. And it should be a little bit squishy, but not mushy.
Exactly.
So that it can't break. So not like apple, but maybe like what other kinds of fruit
Yeah.
might.
So like a kiwi quarter, a banana, um, you could half a banana. Other things to think about, baby's going to grab it and squish it, so we don't want it to squish through their fingers if at all possible. So maybe leaving a little bit of peel on that banana so they can have a little bit of grip to it. Same thing with an avocado. They're not going to bite that off, right? They're going to mostly suck on it to begin with. Um, Mango slices work well. Melon, take any seeds out if there's seeds in that. Um, but yeah, lots of options to start with.
Okay, that's great. I think that's all I have. So thank you for giving us a little kind of introduction to what you teach in the starting solids class, and this is hopefully helpful to anybody who doesn't get a chance to take a class,
Yeah,
because really that's a lot of great information for starting solid foods with babies. Appreciate you talking to me, Janelle.
yeah. Thank you, Ellie.